My name is Brent Moore. I'm a research psychologist with the VA Connecticut healthcare system, and I'm also a research scientist at Yale University. The work that I do is about an automated mobile system, the Veterans Recovery Line. So it's an automated system that's meant to help veterans that are in substance use treatment with their substance use problem. And so it's very direct, it's very much intended to be in the hands of veterans, and it's intended to help them specifically with their substance use problems. It has all sorts of different potential modules that people can use. They're modules that people use to learn about the system and learn about ways of dealing with their substance use. So that may be doing things like relaxation or ways that they can reduce their stress. It can also be doing things like learning about triggers or things that might lead them to use more. And all of the system that we have is based upon cognitive behavioral therapy. And it's embedded from that so that there's these learning modules, and then there's what we call activity modules. So the activity modules are intended to provide people with specific help at that moment. So it may be something like an immediate relaxation exercise if people are feeling really stressed. Or it could be a way of trying to deal with their sense of craving or their problems that they have with craving. And those are called urge surfing, which is a common thing that people do in CBT, but this provides it to them right as they're on the phone. There's other types of modules that we have, and there's other things that are completely distractions and other things that are intended to help people be encouraged about their recovery process and to focus on that process. A real strength of the system is that it can reach people where they are. It's available 24 hours a day, anytime, from any place. People have a phone. They don't even have to have a smartphone with this. They can call on a landline, on a payphone, because those actually still do exist, and we've had people call in on these payphones. And they can get help right then. At that one moment, if they make the decision not to drink or not to use, they've made a different decision than they have previously. And so that changes the path. And as they make that single decision, it makes it easier to make the next decision to not do it. And as they string those together, that's what makes recovery. And that's what's exciting to me, and that's why I think we need to provide tools for veterans to be able to be in charge of their own recovery. We did find several things that were really interesting as far as the outcomes. It was a small-scale study. There were only 35 participants in the study, but we did find that those folks that had access to the recovery line improved on their coping skills. And so we have a measure of coping skills efficacy, and so they improved on those, whereas the other group that did not have access to the recovery line did not. We also found that afterwards, the folks in the Veterans Recovery Line continued with services. They continued to remain engaged with the substance abuse services that were available, but they did so mostly with outpatient type services, whereas the folks that didn't have access to it were more likely to go back to the same program, same type of program, that intensive outpatient program. It suggests that the Veterans Recovery Line might decrease the total amount of services that people might need. We actually work closely with the site of the service. They're the clinical program that we're with, and that's the Substance Abuse Day program in West Haven. And we work with the director, and we also work pretty closely with the counselors and the therapists. And one of the things that I think was really interesting for me about this study was I've done other work like this and worked with the substance abusers and worked with ways to try to improve a product so it could be good for them. But I haven't been able to sort of engage the therapists and the other folks as much. And what we found was we were able to do that quite a bit with this study. And we were able to get the therapists and the counselors enthusiastic and excited about the program. When we were developing this and as we worked on it, one of the things that we did was we did a fair bit of communication with veterans and with staff to try to improve the program and make it better. So the initial program that we had was sort of for a general drug abuse. And so we talked about use and we did all these things, and what we found when we brought it to the new program was there were a lot of folks that were alcohol users, and so you can't just sort of say use. It sounds weird when somebody's drinking. And so we redid the entire program so that it would be specific for alcohol. So we have an alcohol version and we have a drug version so that it can better meet the needs of those individuals. There's layers and layers of appreciation for the veterans that have participated in our study and have decided not to participate in our study and that have had the problems that they have, and yet willing to be open and share their lives so that we can try to help them and help others in the future. It's a very courageous thing, and I think it comes from their past history, from what they know and who they are, and I think if we didn't have that, we wouldn't have the VA that we have.